My name is Juliana Pinacal. I am a physician from Brazil, an OBGYN. In Brazil, we have theoretically a great thing, which is a public health system that serves everybody. But not always it's a good service, and the poor people of Brazil have to rely on the government for their health. And people who have means to afford health insurance, they pay their own and they don't rely on the government at all. And the poor people have to go and stay in lines forever. They have to wait for hours, and sometimes the doctors are not as nice as they should be, and they don't give the care that the patients really deserve.
Yo soy de Uruguay. En mi país hay dos sistemas de salud. Uno es salud pública, que es para las personas que tienen muy bajos recursos y tienen que comprobarlo con los ingresos.
Uno paga mensualmente una cuota y luego cuando uno se enferma no tiene que pagar. Va directamente al médico. Si hay un caso extremo que haya que hacer internación o cirugía, eso no se paga. Ya está incluido en la mensualidad.
Soy de Honduras, vengo de un país muy pobre donde allá en mi país lo de la salud es muy pobre. Casi los hospitales no lo ayudan mucho. En los hospitales no hay muchos médicos, no hay mucha medicina.
La mujer venezolana a nivel de apoyo, de programas como tal, a nivel laboral o a nivel de la familia, tiene muchas carencias. Generalmente, aunque cuando que el país de nosotros es un país tan rico y se conoce como un país que tiene un gran potencial.
My name is Rosia Witty, and I'm the director of the Road to Recovery. Improve the healthcare system is free of charge. It truly is not the best healthcare system in the world, but at the same time, it is a healthcare system that you can go and you can afford. And here in the United States, to me, it was shocking, first of all, that there was no coverage of health coverage for anyone. I mean, you have to have either a job or insurance, or you have to qualify for a welfare type of program to be able to access to healthcare, to have access to healthcare. To me, that was really shocking because I didn't understand how in the United States, with the wealth that we have in the United States, we would not have a public healthcare program that is accessible to everyone, when in an underdeveloped country like Peru, we have one.
Even though I followed the doctor's recommendations and I went on the tamoxifen cancer trial, I still went back to some of the home remedies, and I took castor oil, heated it up, soaked a towel, and placed it over the breast to decrease the tumor. And now I'm cancer-free. And it could have been the home remedies, it could have been the tamoxifen, it could have been prayers. But I believe it was all of the above.
Que si vamos a un hospital o vamos a una clínica es muy costoso. Entonces a veces la gente no va y recurre al médico o a la amiga o al vecino que le recomienda cualquier remedio para que pueda solucionar su problema.
Yo soy de Cuba y me crié en mi país hasta a la edad de 26 años. Soy del campo y todas las cosas que usábamos eran naturales para la medicina, usábamos mucha medicina natural, todos nos cuidábamos con hierbas.
Por el motivo de que la medicina es muy cara, las vitaminas, todo eso, ellos hacen su medicina natural.
They especially should listen to the women's voices, because women are the family's biggest caretaker, or women are the caretaker of the family. And it's important to listen to what they have to say as to what the barriers are. When you listen to Latinos speak, especially women, they always talk about two barriers in specific. One is information, and the other one's communication. The information is, where do I go to get health care for me and my family?
When I was diagnosed with cancer, the first thing I did is to try to find out if there was other Latinas who had cancer, if that was just something very prevalent to Latinos, and I found out that there was very little statistics about Latinas and breast cancer. I didn't know too much about breast cancer, so I figured, okay, I'm going to try to find some information in Spanish, which is my native language. There was very little information about breast cancer in Spanish. When I went to the doctor with my 20 questions, the doctor told me he didn't have time to explain all that to me. So what he did is he made a copy of the latest New England Journal of Medicine back in 1992. I sat in my car and I just cried because even though I was college educated, I still couldn't get past the first paragraph.
Mi nombre es Nilsa Báez, soy natural de Puerto Rico, soy enfermera graduada de profesión. Traté de buscar mucha información sobre el cáncer. No tenía mucha literatura en español.
Tenía que firmar papeles, si no, no me operaban. Y para firmar papeles, pues, yo no sabía. Tenía que explicarme todos los datos antes de meterme a una sala de operación. Y encontré un puertorriqueño que me ayudó y definitivamente firmé. Él estuvo conmigo en el parto cuando me operaron la cesárea.
Me encontraron el tumor. Yo pensé que me iban a dar una información en español, pero no me la dieron, todo fue en inglés. Y tuvieron que ponerme un intérprete por teléfono para yo poder entender qué decía en el papel.
Me enfermé y yo creo que para uno que viene acá supuestamente a superarse un poco, a salir de las calamidades que está en su país, viene y se enferma y le toca peor porque le llegan a uno a su casa unos biles que no sabe uno ni de dónde, tanta cantidad de dinero, y uno con el trabajo que tiene tampoco alcanza para pagar.
En Colombia hay más comunicación con el médico, más comunicación. Uno puede comunicarle muchas cosas más que aquí. Aquí no hay tiempo para comunicarle al médico lo que uno está sintiendo o que se le olvida algo por la edad, ¿no? Puede que se le olvide algo y después tengo que devolverme a decirle, doctora, no le dije tal cosa.
Cuando uno ve al médico, uno ve al médico por unos pocos minutos nada más. La atención es un poco más dividida.
Ma'am, your blood pressure is a little high today.
Doctor, no entiendo.
Your blood pressure is high.
Doctor, no entiendo, yo no hablo inglés.
Your blood pressure is too high.
Doctor, no entiendo, yo no
There's
hablo
definitely a
inglés,
difference
doctor, por favor.
between translation and interpretation. When you translate, you say silla, chair. When you interpret, you take it one step further. You take it to the part where you're not only talking about the language, but you also are interpreting the social cues, the body language of the person, and really understanding where that person is coming from and what they want to say to their provider.
Aquí hay dos barreras principales. Una es el costo y la otra es el idioma. Muchas veces ella, por ejemplo, necesita ir con alguien más. Si alguien no la puede acompañar, que le traduzca, ella no puede comunicarse con muchos médicos.
El médico que me operó es americano y cuando yo iba a las citas de él a su clínica después de operada, él se molestaba mucho conmigo porque yo no hablaba inglés. Y allí la clínica es grande y solo tienen un intérprete y a veces la intérprete estaba ocupada con otro médico. Y él, lo que me hablaba a mí yo no lo entendía y así quedaba todo. Pasé 6 días en el hospital después de mi operación y sí hubieron días que me puse triste porque nunca hubo un intérprete.
El sistema de salud es bueno, pero hay que saber a qué médico uno va, porque a veces con el idioma es difícil, además tienen muy poco tiempo, el sistema hay mucha burocracia, hay que rellenar muchos papeles y a veces uno no sabe.
La primera barrera que yo encuentro es el idioma.
La experiencia con los pacientes latinos que tuve en esa práctica se sentía mucho más tranquilo cuando encontraron que la enfermera del doctor hablaba español.
I really was very surprised to see how Hispanics didn't speak any word of English and how happy they were when they found out that I spoke their language and that I could communicate with them.
My name is Karen and I'm the promotora de salud, which is a health educator. And my parents are from Puerto Rico. And when they arrived in New York, they didn't speak English. So when one of us needed medical care, they would go to the emergency room. which was a problem because no one spoke Spanish and my parents didn't speak English. And it wasn't until my sister, the oldest, who was about 10, she served as a family translator. She would be the one that would translate everything for the doctors to my parents and back and forth. So the brunt ended up on my sister.
Spanish from Colombia is different from the Spanish in Mexico, from the Spanish in Peru, from the Spanish in Bolivia, from the Spanish of most Central American countries. There are different words for different things. So you have to, become accustomed and comfortable asking these questions and being very, very tactful of what questions you can and cannot ask and in what context and when to ask them. Because sometimes women will not be able to express themselves freely in a setting where their husbands are there. So, you have to have the men leave the room, or sometimes you cannot ask a question unless the man is in the room. So, you have to understand there are certain cultures. And even being a doctor in my own country, I would find that my language was a little bit different from somebody who was living in a rural area. It's not only important to be able to speak the language, but also to understand where these people are coming from.
Tienen que tener mucha paciencia, buscarse a alguien que les sirva de buen intérprete para que el paciente entienda bien de qué se trata y de cuál es el motivo de la visita al médico.